So, my first question is what inspired you and your program to increase accessibility and responsiveness for survivors who use substances?
Um, we recognize that there's a very high correlation between victimization and substance use and abuse and addiction, particularly using substances as a means to cope with trauma. And we also recognize that people who do have a substance use disorder are also at greater risk of being victimized because of their disorder. And we have noticed in the past couple of years a great increase in the residents who come to our shelter are presenting the majority of them with substance use disorders. And as I said a moment ago, we really wanted to be able to address that.
So, really just responding to the needs that you're seeing. And so
Would
what
you
are
like
some
to add anything, Brittany?
No, I really think you generalized it. I just started a couple of months ago, so I'm still trying to understand the history behind the coalition and things like that. But basically, when it comes to therapies and increasing, accessibility, I try to, I guess, evaluate or assess client needs and respond to their needs through group therapy and one-on-one sessions. But I could talk about that later in the other questions.
Yeah, that is actually a perfect segue to this next question, which is what are some of the ways that your program integrates support and services for survivors who are using substances, as well as survivors who maybe have a substance use history but aren't currently using?
Okay, I can start this one off, E. So we have a variety of services that assist women in their recovery to sobriety, as well as focusing on self-empowerment towards becoming a better them and just improving their well-being in general. One of the most important services is the group therapies that myself and some of the other clinicians facilitate. And so, as a therapist here between the main office and at the women's shelter, I usually run group therapies every Thursday at the women's shelter just to discuss the cycles of domestic abuse, domestic violence, and the effects that it implements on worsening the victim's substance use. And to add, I also discuss the concept of power and control between survivors and to just educate them in the best responses to their abuser and managing their self-esteem.
Mm-hmm. Yeah.
Is you want to
Um,
add anything, E?
I'll just say that in particular, some of the models of treatment that we use include cognitive behavioral therapy. And although we are not a full-fledged dialectical behavior therapy program, we do use a lot of the skills that are found in the modules for that. So we have a lot of skills building aspects to our individual and our group therapy. We do motivational interviewing. And then we also have several creative approaches to therapy, including art therapy, writing therapy, and yoga for trauma.
A really comprehensive and holistic approach.
Yeah, we're proud of it.
Yeah, that's great. It's so easy to get caught up and over focus on kind of one part of a person and on another. And I can tell that in your program, you're really taking into account the whole person. And I imagine the whole family as well.
I just thought of this too. Brittany has a musical background, and I would love to see you maybe adding some music therapy to our program.
Eventually, hopefully it happens soon. I would love to.
Yeah.
Music is life.
That sounds beautiful. And I hope to stay updated. Please update me when you build out that part. I'd love to hear what you're doing.
Yeah.
Thanks.